Fahima and Ahab have been living in Germany for several years. Both of them volunteer with the German Red Cross. Today, they are visiting a reception center for refugees. They are talking to a doctor and his assistant about the initial examinations for refugees. They can remember that very well. When they first came to Germany, they had to go to the doctor too.
When you come to Germany from your own country, the journey is long and hard. There's a high risk of infectious disease. That's why we have to be examined when we arrive.
I myself was pregnant, and my parents are older. Fleeing thousands of kilometers is exhausting. There wasn't any medical care along the way. When we first arrived in Germany, some doctors examined us. One of the first examinations is an X-ray. Images of the lungs show if someone has tuberculosis.
The doctor told me that tuberculosis is a very dangerous disease and that I could possibly infect other people.
Fahima was pregnant when she arrived in Germany. Therefore, she could not be X-rayed. A blood or skin tuberculosis test is used for pregnant women and children under 15. Dr. Henricus van den Heuvel has examined many refugees immediately after their arrival in Germany. He explains to his patients why these exams are done.
We suddenly have a large group of new people, and we have to examine them all quickly. In the first examination, you have to determine whether someone has an infectious disease, because if they do, they could infect others. If someone has other illnesses, you make a note of it, but you can't treat those illnesses.
During the first examination, the initial medical checkup, the doctors ask about coughing, diarrhea and vomiting, skin rashes and itchy scalp or skin. When the doctors detect an infectious disease, they treat it immediately, or they send the patient to a specialist or to the hospital. All refugees can receive vaccinations during the initial examination. Getting a vaccination protects you and also other people. Adults can be vaccinated against tetanus, diphtheria, polio, mumps, measles, and rubella. There are more vaccinations for children. All vaccinations are voluntary and are only given when necessary. There's a medical station in every refugee center. The residents can go there when they are sick, as Dr. Anke Stamnitz explains. When people come to us for a consultation, they often have several different concerns and several different illnesses. Of course, they hope that we can handle everything here immediately. Unfortunately, that's not the case. For example, someone might come to us with back pain that he's had for years and that was treated in his homeland. Of course, we can treat that here too, with painkillers, but we can't treat the cause or fix it immediately. The Asylum Seekers Benefits Act requires that we treat acute conditions, acute illnesses, and pain. When Ahab arrived in Germany, he received treatment for acute illnesses. In the refugee group shelter, doctors offer, for example, treatment for gastrointestinal infections and influenza, treatment for pain and injuries, and additional vaccinations. Complex exams or operations can only be approved in exceptional cases.
I'm living here with my husband, and it's my 7th.
Specialists care for pregnant women, like Fahima when she arrived. Mostly I was cared for by a doctor in the refugee shelter. But for some exams, I was sent to a gynecologist. They did an ultrasound and determined that my pregnancy was going well. There are rules regarding transport to specialists. Everyone who can must take the bus or tram. In exceptional cases, such as if the patient is very ill or handicapped, the shelter staff will call a taxi. Sometimes there's an accident and someone breaks a leg or is bleeding severely, or someone has a heart attack or gets appendicitis. For emergencies like this, the residents should go to the staff in the refugee shelter. The staff will then call an ambulance because these patients need to go to the hospital. Once my father fell and broke his hip, then the staff in the refugee shelter called an ambulance. When people first come to Germany, it's not clear yet whether or not they can stay. That was the case for Fahima and Ahab as well. But refugees suffering from acute illness or severe pain are always guaranteed treatment.